felt very depressed.
I didn't even know who to talk to about those things.
I was really afraid by that point.
I was hospitalized, and it was extreme.
You could be, living next door to someone that just had a baby and looks super happy when they're out walking their baby in their stroller, but really is struggling inside their home because no one wants to disclose this.
Pregnancy is extremely hard when everything is normal. There are tremendous changes in pregnancy, physical changes, changes in career, emotional changes that go on. Not everybody has all the tools in the toolbox that they need.
When perinatal mood and anxiety disorders go untreated, we know that they can really dramatically impact the financial well-being, the social well-being of women, their children, and their families.
These are patients that have a genuine medical condition, and treatment can be so effective.
We have some fantastic partners in SCL Health for a few reasons. They have a really strong leadership team that has come together to be champions for this work, where all the right departments are sitting at the table and making the kind of concerted effort that's necessary to transform care. And it seems like this is something that everyone is completely bought into and moving in the same direction, even though it's not easy.
The overall goal of this project is to promote the early identification and treatment of perinatal mood and anxiety disorders through universal education, universal screening, and the provision of integrated behavioral health services in the obstetric setting.
We encourage them to actually be able to take the time for themselves so they can be a better them for their baby, is what we like to say. If you better yourself, you'll be better for your baby in the long run. And I think that's the goal for the Maternal Mental Health Program, is to better our parents so they can be there and present for their children. When I first found out I was pregnant, I was really happy, excited, shocked, and couldn't wait to let my husband know that we were having a baby.
When a woman first comes into care, she's screened at her first OB appointment.
We screen them 3 times throughout the course of their pregnancy and postpartum course for maternal mental health concerns.
Mentally, I was drained, felt very depressed.
When a patient scores more than 10, a referral is made into the behavioral health program, and at that time a further assessment is arranged with the patient.
And Kim was one of these patients who scored really high on that questionnaire.
One of the really key aspects of this program is just this multidisciplinary team all having access to the patient and access to each other.
If it weren't such a wraparound, integrated process, it would have been really confusing and hard to navigate. You've got these providers, different providers that you're seeing, and the communication is what really helped out, knowing that everybody was communicating with everybody.
We're providing a very personalized level of care, and comfort is built in between the provider and the patient. And I think when you add mental health services to that environment, patients are more willing to open up and tell us more about themselves.
The other exciting part of this program is that, yes, it's patient-centered, but we're also family-centered. Oftentimes we have an opportunity to work not only with partners, but with grandparents, with aunts, with uncles, with older children, the people that love her and that she turns to most frequently.
Every single day as I am talking with patients, they are really impressed that this is something that we're able to offer.
They're like, I'm doing great, the services you provided me are helpful, my baby is thriving. It's a holistic picture.
It honestly gave me what I couldn't give myself, which was the confidence necessary to have my baby.
I could see Kim switching to this place where she had been trained, she had been prepared to really be able to walk through that anxiety, not let it overcome her, not let it get the best of her. And she had a beautiful baby. In the postpartum period, same thing. She's continued with the behavioral therapy and the medication management, and she is doing fabulous.
I really could not have done it without them. I love them, I do, and I'm very grateful.